Hello and welcome to today's panel hosted by the Council on Criminal Justice. I'm Abby Walsh, the Council's director, and I'm here with a few housekeeping notes before we begin our program today. We are joined by nearly 700 participants, and to ensure a quality experience for everyone, all lines will be muted. But we still want to hear from you, so during today's session, you can submit questions using the Q&A box at the bottom of your screen, or you can email us at info@counciloncj.org at any time during this call. We have a packed agenda, but hope to turn to your questions before the end of our time. At the Council, it's our mission to foster a dialogue on the most critical questions in criminal justice policy. You will see that in action today when we welcome corrections leaders from across the country to share with us what they are seeing, doing, and learning as COVID-19 rears its head behind the walls of America's prisons and jails. It is also our mission to ground that discussion in data and evidence. So let's begin by looking at what we know and don't know about the spread of COVID-19 within correctional populations. Charlotte, could you bring up the statistics for us? Wonderful, thank you. To be frank, there's much we don't know. Testing is not nearly widespread enough within the system or in the general population to confidently assess the true rate of infection. Here we've gathered statistics on confirmed cases from various sources, which almost certainly undercount the true number of infections, instead reflecting testing availability and priorities. While this is imperfect, there are some interesting patterns that emerge when we compare the rate of confirmed cases for adults in custody, corrections staff, and the general public. The rate of confirmed cases for individuals within correctional facilities is roughly twice that of the general population. It is even higher for correctional staff at nearly 3 times the rate seen in the general public. The trend that we've seen generally, which we don't represent here, is rapid growth. And this has been covered by a number of outlets. But whether that rapid spread is the spread of the disease or a ramping up of testing is as yet unclear. Charlotte, could you go forward a slide? Thank you. Now, these patterns reverse when we look at fatality rates. We are seeing lower rates of confirmed COVID-19 deaths within correctional populations and staff than in the general population. Are these numbers reflective of reality? How much do they vary facility to facility? That we just don't know yet. What we do know is that correctional leaders across the country are being asked to make immediate changes to policy and practice in order to protect their residents, their staff, and the community from the virus. Thankfully, we have some of the best in the field with us today to tell us how COVID-19 is impacting their facilities and how data, or the lack of it, is driving their decision-making. To moderate today's discussion, I'm pleased to introduce John Tilley, Council Senior Fellow and former Secretary of Kentucky's Justice and Public Safety Cabinet. John, the floor is yours.
Well, thank you, Abby. And we do have an incredible panel today. And I think it goes without saying, as it always does, that we hope you are safe and well. We know some of you are not. We know some of you have loved ones who are not and people you care about. So keep that in mind. And again, we hope to be able to provide some comfort and some guidance with our discussion today. This is the third in our series. As you know, we began with law enforcement, had a great call, moving to courts, and our third today, corrections and COVID-19. Tuning in, as we have had, again, for the previous 2 calls, our council board members, trustees, members, and again, our directors, our federal, state, and local officials. Nearly 700 of you have registered, and I know our call will nearly reach those numbers as the previous 2 have. Leaders from law enforcement, the military, corrections, and the courts, researchers, advocates, and the media all today with us. So we hope we're welcoming you back. But if we're tuning in for the first time, just a quick word about us here at the Council. We're an invitational membership organization, a think tank, and a center of gravity for the field. And we hope to be guided by the facts. We are guided by the facts and evidence, and above all, justice. And with us today to talk about those very things, to keep the facts before us, and also what they're feeling from the field. Anecdotally, it's important to know what they're feeling and seeing from the field. We have with us a great group, as we've said, And I won't read their entire bios, too long to do, impressive resumes. We will give you a quick word about each and then dive right into the questions and hopefully reserve that 15 or 20 minutes for a good, robust Q&A at the end of our discussion. So with us today, we have Colette Peters from Oregon, the director of their Department of Corrections there, and also the vice president with the Correctional Leaders Association, CLA, formerly ASCA, as many of you know them. And she is also a CCJ, a council trustee. Ed Gonzalez, the sheriff from Harris County, the Houston area, runs the third largest jail in the country, also a council trustee. Lewis Reed, a national organizer with Cut 50, and also a council trustee. And Ann Precythe, the director of the Missouri Department of Corrections. She is also on the executive committee there at CLA as the treasurer. And also she came from North Carolina, where she left in charge of community corrections. And she'll talk about her role there in supervision, which I think is a key part of today's call. So let's get right to it. Colette, director, forgive me if I call any of you by your first names, as I consider you all colleagues and friends, and we want to make this a good, quick back and forth. And we want to keep in mind that we want to cover certain areas first, the extent and spread here, prevention, mitigation, and then release and reentry as well. So with that, Colette, if we can unmute you and get started with the question we discussed, and we all discussed things during the week with all of these callers, but both the state of Oregon and the DOC there in Oregon are reporting a low number of infections. So we'd like to know what specific steps you've taken to make sure those numbers are low.
Yeah, well, I'm very happy to be here this morning, John. Thank you for that introduction. I think that has been all about planning. I think that it can also change tomorrow. So while we have low numbers today, we're holding on tight to that in hopes that that doesn't change. But I think that it really was planning for us. So many of you have heard me talk about the potential massive earthquake that the Pacific Northwest is supposed to experience in the next 30 years. And so our continuity of operations planning was prepared for the worst. It was prepared for a massive earthquake where we would have lost more than 50% of our first responders, including our correctional officers. And so being able to activate that continuity of operations plan, including our pandemic planning that was inside of that out of the gates, was incredibly helpful. We also were able to shut down the state very quickly as we saw the first tests come in positive in Washington and California to the south of us. Our governor locked down the state immediately at the beginning of March, and we were able to do that as well inside our institutions. And while it was incredibly difficult to make that decision to stop volunteers, visitors, and contractors coming into our institutions, I think that was our biggest social distancing measure. You know, we talk a lot about how impossible it is or how difficult it is to engage in that 6 feet of social distancing inside our prisons. But we really believe in Oregon that being able to stop only essential personnel from coming into our institutions really helps slow the spread. Plus, we're really fortunate with our medical team at the Department of Corrections. They are connected at the hip with the Oregon Health Authority and their epidemiologists. So every decision we've made to date has been based on medical advice and medical direction, along with the CDC standards, of course, as well. And so I think it was that preparation, our ability to activate our agency operations center immediately, and really relying on research and data from our doctors to make decisions around next steps.
Well, Director, thank you. And we want to move now again with a similar story and a question to Sheriff Gonzalez and what's going on in Houston and the steps you've taken. We talked a lot about what you've done, considerable steps. And so we want to hit the highlights of what you've done to prevent an outbreak there. We know you've had some numbers with the size of your jail, probably inevitable, and the jail being, again, we have a sophisticated audience with us today, but clearly difference between a jail and a prison for those who might not immediately recognize the vast differences and probably challenges that you face that some in the prisons do not. So Sheriff, what have you done to manage what you have seen and some of the testing measures as well?
Well, thank you, John. Thank you for having me. It's a pleasure to be with all of you and appreciate CCJ for convening this wonderful discussion and bringing all the panelists together. Obviously, you know, we operate a large jail system. When this pandemic started, our population was hovering around 9,000 individuals. About 70% of our population are pretrial detainees. About 25% of them are on psychotropic medications. So it runs a gamut within our system. Today, our population is at 7,500. What we did early on was try to advocate for compassionate release. We were aggressive in those efforts, trying to talk to different decision makers on that. While we didn't accomplish broad mass release up front, we started the conversation, started to inform and educate not only the stakeholders, but also our community. So we've seen that decline in our population incrementally. While we would have preferred to have seen it in one large swoop, it wasn't to be. But we thought it was important to inform and educate the community that it wasn't a matter of if, but when we were going to see an outbreak. We then began to work proactively with our jail population manager. We armed our judges with data in terms of risk factors and other things for them to make the best decisions. And we feel that those efforts have paid off over time. We instructed our community that jail health is community health. We explained that you know, we wanted to, you know, break up that myth that some inmates are better off being quarantined, that it's safer. And we explained the challenges with jail churn coming in and out daily, or 2,000 employees that come in and out every day serving our clients, as well as the potential for a mass outbreak inside our facility that then would spill out into the public health system and the limitations there. We provided data and really made the case. So I think we've seen success with that. On the other side, our medical team has been phenomenal. They've really, every day we poke holes in our plans. We take a holistic approach. Our medical team, our corrections team, support personnel are all on my daily calls where we really take a team approach to our efforts. We've done mass testing every day. We provide our community with our numbers. We let them know that we've tested over 650 individuals within our jail population. At the moment, we have 392 that have tested positive. We've had no loss of life, neither within our own personnel, nor with our inmate population as well. So that's key, that there hasn't been a loss of life. We've taken different steps to quarantine upfront upon booking on the front end. And then we've also quickly, you know, separated individuals when they became symptomatic. When we identify somebody in a cell block, we have a lot of dorm style design within our facility. And so what we do is when we identify somebody that's symptomatic, we pull them out, the others are quarantined. We have found that that individual that was symptomatic, obviously the rest of the cell block tends to test at about 70% positive rate on the others. So being able to intervene early and then pulling out those that are symptomatic, and it's a lot of moving parts, but we've been able to monitor in real time, use that data to then drive our decision making and provide good results. Up to through today, we only had one individual that was even hospitalized. Now we have a total of 4, but that's been since the beginning of this pandemic to now. So I think that's pretty good results. And again, providing that transparency to our community, I think has reassured our community that we're running a good operation, that we're effective, that we're following science and data. And I think that we've built some good, strong capital with our community. And I think that's important so that we could ease the qualms of our inmate population, their relatives that are on the free world, as well as our stakeholders and elected officials and others.
Well, thank you, Sheriff, and clearly leaders in the field here. But I think it's important. We've got a leader in the reform community and an advocate and someone who has spent some time incarcerated. And that's Lewis Reed, our national organizer with Cut 50. And Lewis, I was struck by our conversation, and I wanted it to continue about your communication with, as you mentioned, hundreds of those who are at the federal, state, and local level. And just sort of that, some of those really personal communications, they are at their very core personal communications with those who are behind bars and are feeling things that they haven't before. Incarceration under what you might say normal circumstances has its own set of concerns and emotions, but tell us about what that feels like now, like no other can.
Well, first and foremost, I think that if we had other jurisdictions throughout the nation that were taking the leads from Director Peters and Sheriff Gonzalez, I think that we would be much more better off within our institutions, and we would definitely be preventing more deaths. But more specifically, I am in contact with more than 360 individuals nationwide, people who are on the federal level, people who are on the state level, people who are on the local level. And they are just reporting literally to me day in and night out, Louis, I am going to die in here. Case in point, there was an individual that I spoke with who was incarcerated in the state of Connecticut. His name is Caleb Martin. We spoke approximately 3 weeks or so ago. Chronic asthmatic, incarcerated for a technical violation. And he literally begged us to do something. And unfortunately, 48 hours after he was released from custody, he passed away from a COVID-19 infection. 26 years old, 26 years old. And in my mind, I think that is one death that is too many, irrespective to whether it's in one state or if it's in all 50 states. That is one death that is too many. Just yesterday, it was very widely reported that there was a woman in federal custody, 30-year-old woman, I should say, serving a 26-month prison sentence on a drug charge. She died of COVID-19 on April 28th, weeks after giving birth, while on a ventilator. That is something that we need to prevent. That is something that, us at Cut 50, we are trying to work hand in glove with progressive jurisdictions and a Department of Corrections to make sure that the voices, the muted voices of those individuals who are on the inside, that their voices are amplified and we can actually translate their experiences to the likenesses of the Sheriff Gonzalez's, the Director Peters, and also the Director Ann's as well.
Yeah. Well, thank you, Louis. I know we'll come back to you for some of that same sentiment and some of that same perspective that only you can give us, having been there and been in communication with so many, and how we know how important your work is today. And we turn to a friend, Ann, Director Precythe in Missouri. And I would note that to those on the call that, again, the resumes, again, go to our event page and look at the resumes of our panelists today. But I think it's again, relevant to point out that, and you came up as a probation and parole officer, and I think to talk about what reentry looks like. But so let's start though with some of the positive tests in your facilities, and having steps that we know you've taken to contain any kind of outbreak. And I think your testing protocol has been important for both those in custody and staff. So tell us a little bit about that, and we'll eventually move to the reentry portion of our discussion.
Great. Thank you, John. I really appreciate being included with this panel. I am really proud of what we've been doing here in the state of Missouri, and I feel like I have to give the majority of the credit to our staff, because from the very beginning, they have taken seriously the precautions that have been laid out from the CDC, from our Health and Senior Services, and we've continued to communicate with them regularly about the necessary importance of the social distancing, the sanitizing of the area around you. We've been doing the screening and the temperature testing when anyone comes into our facilities. We had an incident at one of our institutions where we had 3 employees that tested positive and 3 offenders in one wing of a housing unit. So we did boxed in testing, and Thursday, a week ago, we tested 64 offenders and 82 staff that were either assigned or had been in direct contact with that particular wing. We found 20 positive offenders and 0 positive staff. One of the positive staff that we had initially came from that particular wing. So we immediately isolated the positives along with their cellmate, and then put the other negatives in a separate quarantine wing. From the beginning, we established what we call an aggressive viral containment plan. And what that did was, as soon as we had the first symptomatic person, we quarantined the entire wing. What we know now, after having all of the positives in that one particular wing, because we've done the screening in the other 3 wings of that housing unit, there are no positives in those. There are no symptomatics in those. There are no temperatures. So we feel very confident with our viral containment plan. The other thing that's been really important about this is how we've communicated to the offender population. We want to make sure that they understand the things we're doing are things we're doing for them, not to them, and that we are in this together, staff and offender population. This virus does not distinguish one or the other. So these are things we've got to work on together. So I'm pleased with the rate we're going. There is no trigger for all of us to know when do you do large group testing. So I think it's incumbent upon each of us as administrators to make those decisions. When is it the right time to test multiple people?
Well, again, thank you, Ann. From director to another director, Colette, I'm going to come back to you. Again, our conversation, again, I was struck by, so California, for instance, is not taking new prison admissions, but you took a different approach in Oregon, working with your governor, and you're taking those. I think it's, 350 a month up to new admissions. And tell us your rationale for that. I think it was an interesting one.
Yeah, John, thank you. So we're actually legally required to receive those adults in custody once they've been sentenced, and the county jails transfer them to us. We did, of course, have the conversation like other states, but the impact on the local county jails would have been too grand. Not only was I legally not allowed to do it, but the resources in the community are completely stretched thin right now. The jails are trying to figure out who they can release in order to maintain some degree of social distancing inside those institutions. And so the approach we took, and again, like Director Precythe said, our corrections professionals have just been amazing throughout all of this, including our team at Intake, who completely re-envisioned, reimagined what it would mean to accept people who might be positive from the community. We have not had a positive test come through yet at Intake, which is fantastic, but we have set up a quarantine system for those individuals that are coming in so that they are separated from the rest of the population and quarantined for 14 days before they move further into our institutions, and do essential screening daily as we're monitoring their medical case. So far so good on that perspective, but you're right. While normally we receive about 400 intakes every month, with courts shutting down and law enforcement being stretched in other directions, we're down to, I think last month was 313 new intakes.
Wow, yeah. Well, thank you, Director. Sheriff, I'm going to come to you next because I think it's accurate to say that Texas has stopped those admissions, correct? That they have, and I'd love to hear from you about what challenges that's created inside your jail, given that the opposite approach in Texas.
Yes, as of this morning, we have 225 clients that are ready to go to a state facility that have not been accepted. So we obviously have to continue to care and protect them. So the more people we have, obviously, the greater risk there is for our personnel, for them, and others. And so that has posed a challenge with the volume that we have. You know, again, our population is 7,500 today. For us, it just continues to just minimize any chance of us doing any type of social distancing. So back to that jail churn, it's really complicated when we keep having individuals here within our system that can move on. One of the things that we've done also is to make sure that, and this happened before COVID, we created a public dashboard where the public can see what our daily population is and what it looks like. I think it's important for us to put a face to what our population is. I think that we can't check humanity at the door. I like what others have said already, is that we're all in this together. This virus does not distinguish between who it's going to infect. So we've got to know who's in our population so we can continue to make those decisions. We've also worked closely to provide a video capability for our parole hearings, probation hearings, so that they could expedite those hearings as well. We've seen success with that. So leveraging technology has been a plus. But back to that dashboard, it's been very helpful so that the community can see what our population is. I know that as of today, I have 910 individuals in our facility that are between 46 and 55 years old. The community knows that we have 427 that are between 56 and 65, and I have 74 individuals that are 66 and older. Our medical team daily also prepares a medical data sheet with those that are the most vulnerable. So at moment's notice, we know who we should try to expedite the release. So it all works together. Data is so critical. And that's why we've been trying to make the best decisions by being armed with the best data possible.
Yeah, Sheriff, yeah, that's a great segue to go back to Lewis. Now, Lewis, you and I, again, also talked about, and I know Cut 50 has proposed a responsible release strategy, and I know we've got different opinions on how that should happen across the country with whether they're corrections leaders or advocates, researchers in the community, law enforcement. But from your perspective, what is that release strategy, and how do you think we should go about that? And feel free to, again, have this discussion with the leaders on the call today and those in the audience.
Yeah. So listen, I think that the sheriff is hitting on something that we all need to be cognizant of, irrespective to whether or not you wear brown or if you wear blue. This virus is indiscriminate. We are talking about human lives in this conversation. We're talking about mothers, we're talking about fathers, we're talking about sisters, we're talking about brothers, we're talking about people who are eventually going to make up the fabric of our community. We want to make sure that they are safe. We should be making sure that all Department of Corrections across the United States of America are providing the great degree of transparency that the sheriff is alluding to. And we also need to make sure that individuals are safe, that they come out much better and much healthier than how before they went in. And so specifically as it relates to our plan, look, in our minds, we don't think that this takes you having more degrees than a thermometer in order to be able to do something. First and foremost, we need to make sure that we are identifying people who are scheduled to be released from prisons or jails within the next 6 months, and we need to get those individuals out into home confinement, barring a specific reason not to do so. That's number one. The second thing is that we think that we need to parole people who are over the age of 65 with priority given to those individuals who have pre-existing and or other underlying health conditions that make them particularly susceptible to the virus. That's number two. Number three, we need to suspend co-pays for medical visits for people who are incarcerated when they have to go down to medical. All of that stuff needs to be suspended. The next thing, we need to make sure that hand sanitizer stations and or other personal hygiene products are available to people who are incarcerated free of charge. I personally, as someone who did almost 14 years in federal prison, I think that it's absolutely asinine that you have a state like New York that are having people produce hand sanitizing equipment where the offender population can't necessarily use it because it's considered contraband. And last but not least, we need to make sure that we are implementing smart social distancing policies to protect the more than 4.5 million people who are under some form of community supervision. So look, this is not a matter of our heads, this is a matter of our hearts. And ultimately, in time, our values are going to be interrogated, they are going to be prosecuted, and they are going to be evaluated by how we responded to the so-called least of these.
Well, thank you, Lewis. And I think we're going to turn to the Director Precythe and to you in a minute. I think we're talking prevention, mitigation, and also release and reentry. We've talked about the spread and what exists today. We've got good numbers from these. We know that numbers aren't so good elsewhere in our country, as has been described on the call as well, and in the media, clearly. But, you know, and you again, coming up with a background in supervision, but also talk a little bit about release and reentry. But again, I want also to give the group a chance to address some of that. So let's back up and just quickly tell us about the ability to provide things like soap and hand sanitizer in your facility. And I think it goes without saying, in other conversations, I think that has been very possible with the sheriff and Director Peters as well. But Ann?
Right, and I'll just tell you, in Missouri, we made sure that we had enough sanitizer available in the housing units as well as on the grounds within our institutions for staff and for the offender population, and that they have enough soap. You know, I sent out a message saying that I wanted to make sure all our offender population, I sent it directly to them, that they practice social distancing, that they wash their hands frequently, and that they were clean and sanitizing their areas. And somebody asked, do your maximum security offenders have access to enough soap? We made sure that they did, because I agree, how can you ask someone to take care of themselves and then not provide them with what they need to be able to do that? So those are some of the basic things. You know, as far as the social distancing, or we call it social distancing, but also cross-contamination, part of our cohorting and our containment plan is making sure that housing units stay singular and that they're not mixing with other housing units. And we have specific staff assigned to housing units so that we're not cross-contaminating across the whole facility. So I think there are a lot of measures put into place across the United States that a lot of friends and family of our populations aren't really aware of what we're doing. So I appreciate this opportunity to be able to get some of that stuff out there.
Yeah. In our remaining time, I do want to touch before we get to Q&A from our audience. We hope to do that for the final 15. So for the next 10, I'm going to stay with you just for a minute. Ann, if you could touch on reentry. On the best of days, reentry is a difficult proposition. It just can be just that for those, you know, coming back. Talk about what that means now, what it looks like now with this added complication.
You know, I'm just sitting here thinking, okay, so two of the most basic things that people leaving prison need are jobs and treatment. Both of those have shifted significantly. In many places, the jobs don't exist, nor are the employers who were totally able and willing to hire former offenders, they're not hiring right now. So that's a challenge. Treatment modalities have shifted totally to technology for the most part, and not everybody's comfortable using that. But the other one that comes to mind is housing. And in some places, shelters and housing have become more challenging. So I, again, am really proud of my probation parole staff. We have had to shift how we supervise to what we thought was going to be a multi-year plan to go virtual to a 45-day plan of being totally remote reporting. And my staff love it. What they're seeing is that they are more engaged with the offender population, and the offender population is more engaged with them. The ability to use technology to check in rather than have to get on a bus, leave your job, do whatever they have to do to go see the probation officer for 20 minutes. Now they're checking in and everybody's responding. And so now the failure to reports are down, the communication is up. So the challenges on a good day are still there, but there are still some positives that are coming out of this. And when I get down to it, I'm really hoping that the mindset of our communities becomes balanced so that we recognize the good that has come out of this challenge, and then how do we maximize on that to continue to help people be successful? Because I really don't want to think recidivism is down now and then it's going to go back up because of how we used to do things.
Right. No, thank you, Ann. Poignant. I think probably turn to Colette now, Director Peters. Even though you don't directly oversee the supervision aspect and reentry, you are clearly have a great interest in that preparation for reentry begins inside the facility, and your position on release or your strategies. I'd like to know. I think we'd like to know a little bit more about what you've seen in Oregon and what some of the challenge you think exists there with regard to release and then the ultimate reentry of these folks.
So Oregon is very unique. We have 36 counties, and most are run by the local authorities. So 34 of the counties are run by county officials. 2 of the counties do report directly to the Department of Corrections, so Douglas and Lynn County. But the partnership between all 36 counties and the Department of Corrections is incredibly strong. It is certainly a fluid relationship. And we knew that the reentry and transition of these individuals was going to be complicated during this pandemic. So we pulled the counties together, we pulled health services together, all of community corrections to really talk about what does that evidence-based planning need to look like. And we actually really relied on all 50 states to see what they were doing as we began to prepare for this pandemic. I think it really is, as the sheriff has said, as Director Precythe has said, it really has been around transparency and communication with those local communities who are scared. You know, we really haven't talked about the fear factor yet this morning. We're all in a state of heightened alert, worried about this disease, what it's going to do to our families, our friends, our loved ones. And the same is true for those who are incarcerated. That fear factor is high. Lewis alluded to it a little bit. And so I think being very mindful about that and talked about the community's mindset. We need help. We need help convincing the community that these individuals who are incarcerated were part of their community before they were incarcerated, and they're certainly part of their community now as we transition them. Because some of my concern is the fear factor turning into a bit of a scarlet letter for these individuals releasing, especially those releasing from facilities where we do have positives. And so hoping to really be transparent with those community members so that they are welcoming them back in a state that's difficult, as Director Precythe said, where we have limited housing now. If you are a residential provider still operating and accepting individuals who are releasing from prison, you're probably only operating half of your beds in order to maintain social distancing. If you are a hotel that's still open and welcoming formerly incarcerated individuals into your hotel, those hotel beds have been cut in half in order to maintain social distancing. And so those lack of resources have been very complicated in this. The last thing that I would like to weave into this answer, John, is concern for our staff as well. As we talk about community mindset, we have had some negative reactions in the community to our staff in uniform shopping at the grocery store, maintaining social distancing, but knowing that they had come from a facility that had received positive testing. I really would love a call to action for folks listening to really reach out to those corrections professionals and understand that they are first responders. They are essential personnel during this pandemic, and they need to be treated with compassion and supported in our communities right now more than ever.
Yeah, I think we'd all agree with that, Colette. I'm going to stick with you just for a short answer on this, if you could give us as brief as possible before we move to the sheriff for his feelings on a little bit of what he sees with regard to churn and how that's different from prisons with that kind of reentry, again, from a jail. But Colette, Oregon's not adopted a mass release strategy at this point, understanding your population generally has been down for several years in terms of a per capita perspective. But Colette, what is the strategy there in Oregon with regard to release, and are you comfortable with it?
Yeah, great question. We've had substantial conversations around early release. To Lewis's point, really considering those who are 60 years of age and older, those who are considered vulnerable. And the governor has made the decision not to move in that direction because this is very complicated. And Lewis and Director Precythe alluded to this. Counties are shut down right now. The resources in the community are very limited. And so as concerned as I am that someone would test positive for COVID inside the prison and die from that disease, I'm equally as concerned that we would engage in early release and release someone into the community, into the homeless population, and test positive and die in the community. And so if we are to have that conversation, it has to be very mindful, it has to be very thoughtful. As we assess the community resources that we have in Oregon today, we are still releasing 400 individuals every month into the community just based on our normal numbers and our normal end of sentence time for reentry and transition, and we barely have resources for those 400 individuals. And so for Oregon, I think it would be a misstep to push those individuals into the community in a mass release without resources and without medical services to help support them. So I don't like to think of a prison system as a social services system, but in the midst of the pandemic, I can say that we have 15,000 individuals who have 3 meals a day, a roof over their head, and access to quality medical care.
Yeah, and I know, and Lewis and I'm going to go to the sheriff first, but I want to hear from him, but I also want you to be prepared to respond to that. I know you and Colette are close, to be frank, and you all communicate and you have respect. I know you may have a different take a little bit on that, and we want to get to that before we get to questions, but Sheriff, briefly, what's it look like? How's that different from jails? How does that churn different, the reentry process for jails different for you and your community?
Well, for us, our population is very dynamic. It changes daily. We're still averaging, even with reduced bookings, about almost 200 bookings per day, just because we have 1,700 square miles and a large number of policing agencies in our county, and we're a large urban area. With that said, we continue to really take thoughtful approaches. We have a robust release plan, discharge plan that takes place where we're working with service providers. We continue to develop a continuum of care where those individuals, and we have about 22% of our jail population that self-identifies as being homeless. We're connecting them either to a service provider, a drug treatment program, or our public health system here has set up some hotel rooms where they could be able to have proper care as they transition into the community. We've also made sure that there's a warm handoff. It's not just you're out the door, you're gone. We're connecting them with family members. We're making those phone calls. We're giving them additional medication upon their release so they don't have to worry about that medication and accessing that upon release. We're also making sure that they have all the information that they need to make sure that they're masking up and doing all the things that are required in the community. The other thing as well is understanding our population. I know when I took office and became elected sheriff 3 years ago, that 90,000 children in our county have a parent that's incarcerated in my jail every year, an average of 90,000. So we're doing as well, both tomorrow and Saturdays, we're gonna have a food drive that's focused on those families that have someone that's incarcerated. And what we found is very positive feedback from our clients that are incarcerated because they see that we're also taking care of their families. And that goes a long way. And so we're thinking beyond just the proverbial 4 walls of a jail cell. We're leaders and it's time for us to lead. This unprecedented time has brought a unique opportunities for us to really step up and be leaders in our community and be in our region, in our profession. And we're trying to build a plane as we fly it, but we're also trying to think more broadly and thinking, how can we really make a difference? So we're excited about that food drive. We're also not forgetting, as we heard Colette said, about our own personnel. We know that anxiety is high. I have over 192 personnel inside our jail that are currently infected with COVID. We know that impacts other of their colleagues, but they're still showing up to work. So we're doing equipment drives for them as well to make sure that their families are taken care of while they're at work and have the mask and essential goods that we provide them for free. So we're taking care of the families every day, and this has been very helpful. We provide a daily newsletter that our communications team puts out to all our staff so that they can know what's going on. So often we communicate to other stakeholders and not our own. We want them to know in real time what's going on, how we're addressing challenges, opportunities for mental health support so that they can get the help they need. So it's really a comprehensive approach that we're taking, and we've done the things necessary as well, like eliminating the co-pays. We're providing our jail clients with a snack bag every week with some popcorn, a few little treats just to let them know you're in this with us. Thanks for doing what you can to help us navigate this pandemic. And so we're working with our food provider to accomplish those snack bags and other things. We advocated for the free phone calls. So we're really trying to leave no stone unturned, if you will. And that's part of being willing to know that some things we're going to do good, some things we're going to do great, but we could always do better. And I challenge our team that I don't have all the answers. We need to poke holes in our plans daily. It needs to adapt daily, just as this virus does. But now is the time for us to lead. We could be tough on crime. We could believe in accountability. I'm a police officer by profession. That's how I started my career. But we do not have to forget the compassion in this. Humanity doesn't have to stop at the door. We could really lead and lead strongly and make sure that our communities are stronger because of the efforts that we did inside our jail population.
Yeah, perfect time to head to Lewis now. Lewis, you've heard from Colette and the sheriff, and I know Ann has a strategy on release, and we may get to that because we have a lot of questions from our audience with regard to release. It seems to be a theme and an interest here, clearly. Lewis, your thoughts?
Yeah, so I'm an advocate. My perspective on this call is definitely going to be different from my colleagues. There's one of several things that I want to say in regards to what Director Colette alluded to. I don't think that we have the right, nor are we in the position to make the call for an individual as to if he or she, and I know that this is not what she was saying specifically, but as to if he or she is going to be released, and if there are not community supports within the community, if there's not an infrastructure within the community to support that individual's release, that we should think twice as to whether or not we should have him or her back into our community. I have never had a conversation with anyone to say, hey, I'm sick, I am at risk of being infected with COVID-19. However, I don't want to be released. I don't want to get back to my family. I don't want to get back to the community. This is a moment to be bold, to move ideas forward that might not have been doable just 2 months ago. My colleagues are clearly being responsive to the crisis, but now is the time for bold ideas. It's a time for questioning how we can do business. The people I talk to in jails and prison, they want to know that their lives matter as well. COVID-19 hasn't created a crisis in our jails and prison. In fact, it's illuminated one that has existed for decades. America is not just resilient during crises, but we have always evolved and done better. The question is, how do we look back in a decade and realize that this pandemic was a moment when we ended the warehousing of human beings? And last but not least, for people in prison, perfect can't be the enemy of good. We need better reentry. We need better services in prisons and jails, but the people I serve, that we at Cut 50 are making sure that those muted voices of those who are on the inside, the family members of those who are supporting those individuals who are on the inside, they want relief, and they want relief now. And so I, without compunction, applaud the efforts of my colleagues who are on this call. I applaud the efforts of the dedicated men and women who are in uniform that are doing their best to show up day in and night out to make sure that the people who are on the inside are protected and that they are served appropriately. But we have to do more. I just want to say one more thing, John, in closing. I also had a conversation with an individual yesterday in the Department of Corrections in New Jersey. He said that he's in a dorm style setting. He said that his cellie went to medical. This guy was obviously warm to the touch, went to medical, was experiencing signs of COVID-19, and medical had him chew on ice chips before they took a temperature reading. And so I know that that is not necessarily the vast majority of the dedicated men and women who are in uniform, and that's not how they operate. But the fact of the matter is that when one person, when one system operates like this, we have to have a proactive response to it. And so we need to do more. This is an opportunity to do more. This is an opportunity to push the envelope. And this is also the opportunity to make sure that the human beings who are incarcerated are protected, that they are served, And if I'm going to tap into my Bible a little bit, that they are in good health and prosper, even as their soul prospers.
Yeah. Thank you, Louis. And I know these leaders, these correctional leaders would agree. Abby, let's see if we can jump to some questions in our final few minutes. I know we're short on time, but again, with a discussion that good, it's tough to get to the Q&A, and hopefully our leaders will continue to be there. Abby, do you have some from our audience?
I sure do, John, and we have lots of great questions in our Q&A today. We can't possibly get to all of them. We'll do our best here, but just so that our folks submitting questions know, we are happy to pass these comments and questions also along to our panel as feedback and try to address them in future sessions as well. But with that, one question that we've received, I'm going to direct this to Director Peters first, but any of our panelists can speak to this. Could you expand a bit on the relationship that has developed between DOC Medical and Oregon Public Health? What has proven most helpful about that relationship? And to Director Precythe and Sheriff Gonzalez, and also to Louis, how are you seeing those relationships in your jurisdictions or in the jurisdictions that you're working with and advocating in?
Thank you. Thank you very much for the question. I think for us, while we have always had a relationship with the Oregon Health Authority and public health, that bridge has just gotten bigger and stronger. And I think it has helped give us confidence in our decisions. It's helped the community feel more confident in the decisions that we're making as we lean into two sets of doctors to make these decisions. But I think the great thing that has happened is now that that bridge has been built, they're already talking about post-COVID, what type of relationship can we have with that agency in caring for those who are in our care. You know, I think it's important for the public to realize that we run a healthcare system inside our prisons. And that realization, I think, is coming to fruition in this pandemic. Where we have really had to work is with our county public health officials. That bridge was not there. That was not a relationship that we had built prior to this pandemic. And so that's been a lot of hard work, rolling up our sleeves, building those relationships, creating processes as we release these individuals into the county, and just trying to be as transparent and communicative as possible between state government and local county government.
Sheriff, let's go to you next. If you can give it just a minute or a minute and a half there, so I'll give time for Ann and Louis to weigh in on that public health, great public health question and those relationships in your community. Sheriff?
Yeah, but we have a Harris County, a county public health system, as well as a city public health system in the city of Houston proper. So for us, for me, I think something to look back on as we get past this will be that it seemed a little bit fragmented for my taste. While we get assistance from them as needed and we work with them closely, I think that sometimes it's a little bit siloed because sometimes it's based on where our jail system's located. While we may be a county agency, we still sit within the geography of the city of Houston. And so sometimes it's a little bit fragmented. We know that they have their hands full as well doing the public testing and navigating the public health systems and the broader community. So I think it's important for us to just sit down and, as was alluded to shortly, we operate a medical system within our own confines. And as I said earlier, jail health is community health. So I think that it's just a matter of making sure that we see how we can improve process flow. But while it's effective and it works and there is communication, it's a bit fragmented.
Absolutely. Ann, would you add to that?
Yeah, just briefly, because I think I can echo a lot of what Colette said. If anything, the good thing that has come out of this is just the awareness of exactly how complex and how needed the institutional community needs their public health department and their health and senior services state department. So it's really opened up the communication for all of us, and it's been a very in tandem effort. And so in our one institution that has the positives, we've really built and cultivated this relationship with our public health department. I think that's been a very positive thing. I'm encouraging my other wardens to now reach out to their local health department and let's start that conversation so we don't get in this situation and then start meeting each other. So, I mean, I think it's there's always something good that can come out of something challenging or something bad. And so we're going to use it to our advantage.
Louis, you're talking to folks who are hopefully coming out, who will come out, who are hopefully being released now. The importance of obviously medical care and public health that goes unsaid, but do you feel that's being prioritized more than it had been, let's say, when you entered?
Well, I can tell you this. When I was at the City of Bridgeport, I was the inaugural reentry director, and I'm a licensed clinician as well. So I don't see that there is a dichotomy between public health and criminal justice reform. I think that there's an inextricable intersection here. And so one of the things that I tried to do with the individuals who were going to be returning back to the largest city in Connecticut was make sure that we facilitated what we call in psychology biopsychosocials. We looked at their biography, we looked at their sociology, and we looked at their psychology, not when they got home, but we looked at them 6 months prior to them releasing back into our communities. We wanted to make sure that they were engaged prior to returning back to the largest city in Connecticut. With that having been said, I think that it's helpful for us to understand and have some perspective on this. The entire Department of Corrections collectively, nationwide, is one of the largest healthcare providers in the country, along with the VA hospital, et cetera. And so I think that this is an opportunity to ensure that we have the best, the brightest, the most compassionate, those individuals specifically as it relates to those men and women in uniform who are going to be administering healthcare, who are going to be administering mental health, who are going to be administering clinical services. We need to make sure that we have the best, the brightest, and those who are going to be the most passionate about ensuring that those who are going to be returning back into our community are better and not more broken and not more bitter.
Well, Louis, a great way to end the call. We've got to end it somewhere. It's time for that. We want to thank our incredible panelists. I know we have some announcements we'd like to get to, so tune into our website for those. We'll have a write-up summarizing this call, the great contributions from our distinguished panel again, very important. And also tune in for the next in our series, the 4th. We'll be making that announcement shortly about that. We want to continue these calls. We've had overwhelming response, and we thank you for that. So with it, continue to be safe and well. Thank you, and look forward to the next time.